Well, look at here. We have made it. This is the final destination for the micro series. We are done. We have gone through all of the micro together, all but one, which is left, which is today. Let's do it, shall we? Fungi. Now remember, your dimorphics are highlighted, and I talked about those earlier. Okay, so yeast and the beast, right? They're going to reproduce by asexual budding and then mold in the cold, in which they will reproduce or which they'll be in hyphae form, I should say. Remember Sob's auger? Sob's a fun guy. Remember from a long time ago, maybe. All right, Sob, because you have the Sob rod auger. It says Sob's a fun guy for fungi. Get it? Anyhow, okay. Ergosterol is going to be in the cell membrane as well. So let's go over here to superficial, shall we? Malassezia furfur. All right. You guys might know that as Tinea versicolor. And you'll see an increase in that in hot, humid weather. All right. Hypo and hyperpigmentation throughout the skin. It has a spaghetti and meatball appearance on microscopy with a KOH prep. All right. And so that's going to be with the KOH prep. All right, what else do we use KOH for? Do y'all remember? With test. All right. So anyway, treatment is for miconazole, or is with miconazole, or you're going to give selenium sulfide. You can get that in like Selsun Blue shampoo. That's right. Just put that on there in the shower, and boom, baby, you're helping it out. All right. And so then down here, there's Wernicke right below it. What you get with that is Tinea nigra. Okay. And so cutaneous. That's all we're going to say about that. All right, and so cutaneous, right over here, I've talked about those. Basically, you're going to have pruritic lesions with central clearing. It looks in the form of a ring, more commonly called a ringworm. It's not a worm at all. It's a fungi, right? Those are your taenias, like I talked about, your, Tinea capitis, Tinea corporis, those types of things, which is, you got your jochias for your Tinea cruris, that kind of thing. All right, so let's talk about subcutaneous. All right, sporothrace schincki right here. All right, so sporotrichosis, I think is the name of the disease that it will cause, and it is dimorphic, like I talked about. And so potassium iodide is what you're going to treat it with, all right? And it's the rose gardener's disease because it has cigar budding yeast on vegetation. Well, that's not why it's the rose gardener's disease. I shouldn't have said because there, misplaced because. But anyway, the reason it's called rose gardener's disease is because it inserts through your skin through a rose thorn or through trauma while you're out gardening those roses, right? You have local pustules or ulcers with a nodule that drains along your lymphatic system. Okay, sometimes has ascending lymphanginus, anyway, it's inflammation of the lymph and it ascends. Okay, I'm really going to have to write these words down sometimes. I apologize because my vocabulary has gotten progressively worse, and so I'm sorry about that. But anyhow, your systemic mycoses. All right, all these can kind of cause pneumonia-like symptoms and can disseminate, and they're all dimorphic, as you see. All right, and so they can grow mold in the cold at 20 degrees Celsius and below, and yeast and beast at 37 degrees Celsius and above. You can treat most of them with fluconazole, from my understanding, and if they're a local infection, and if they go systemic, then amphotericin B. Okay, and so the systemic form may mimic like TB, get a little bit more serious, but you know you really won't get this one, from my understanding, like person to person spreading as much. So let's start. All right, let's go with the histoplasmosis at first. You find that in Mississippi and Ohio river valleys, causes pneumonia. All right, macrophages are going to be filled with histoplasma, so these are going to be inclusion bodies in the macrophages. All right, I've tried to highlight all your inclusion bodies as we've gone along. And so you get this from bird and bat droppings, if they're spelunking in caves and have guano, all right, contact. So histoplasma is actually smaller than the RBCs, and so or blastomycosis, let's go to that one right up under it now, all stays east of the Mississippi River and in Central America. All right, so the East Coast and Latinos, all right, imagine them having a workout contest or something, and they're trying to see, who's going to be blasting those muscles or something of that nature, okay? Has a granulomatous nodule formation, has broad budding yeast, as Dr. Gullion says in his rapid review lecture. If someone told me, he goes, broad bud yeast, all right, big broad buds, big broad buds. Woo, that's a tongue twister. Anyway, you see big broad budding yeast for mycostes. Okay, they're just blasting out there. Now, coccidioides, all right there at the top now, coccidioides immitis. Uh, Mostly, you'll find that in the Southwest, out in Arizona, California area. It can cause pneumonia and meningitis. Earthquakes may vomit up spores and cause an increase in occurrences. Like, seriously, around earthquake times, okay? Spores in the dust become spherules in the lungs, and the spherules will then be filled with endospores, okay? And these are way, way larger than RBCs, as opposed to the histo, what I was telling you was smaller than RBCs, red blood cells. So, paracoccidioides, find that in Latin America. All right, armadillos can carry it. You get infection with puncture wounds or inhalation from soil. Somebody's out walking, get a puncture wound or something, barefooted. You might get this down in South America. Lungs are the primary source of infection here. Pulmonary fibrosis and cor pulmonale can be the sequelae of this, and budding yeast with pilot or captain's wheel on this. Okay, and these get way larger than RBCs as well. And the captain's wheel, like it literally kind of looks like that. They just kind of call it the captain's wheel. All right, if you're looking at it microscopically, that's paracoccidioides, okay? So, opportunistic infections, Candida albicans, it's white, can be systemic or superficial. It can be oral and or cause oral and esophageal thrush in immunocompromised individuals. Also, can cause vulvovaginitis from antibiotic use, changes your pH, and then it starts growing down there. Or for diabetics, also, it can cause diaper rash. Not diaper rash for the diabetics, I'm saying you can get this in diabetics also, period. Diaper rash may be caused by this as well, period. Endocarditis and IV users also may get this, all right? Or IV users may get endocarditis from this. Y'all know what I mean. It's getting late. Anyway, treatment, you can use topical azoles for the vagina treatment, and then fluconazole or capsofungin, or fungin, I guess is how you would say it, for oral or esophageal forms of this. And I'm just going to spell that word out for you because I don't want you guys to have to rely on my bad mispronunciations. Okay, go ask your physicians if they can pronounce some of these things, because I know for me some of these things are very, very hard for me to pronounce. Okay, so let's go on down. Let's see, we got Cryptococcus neoformans right there. You're going to find that and diagnose it with Indian ink stain, causes meningitis, heavily encapsulated yeast right there, okay? Soil and pigeon droppings is what you're going to get it from. It has a very soap bubble-like look to it, and it has soap bubble lesions in the brain microscopically. Latex glutinogen test will detect the polysaccharides in its capsular antigen. Remember, it's in some killers have pretty nice capsules. It's the C in capsules, okay? Um, Mucor rhizopus, non-septate. This is non-septate, does not, is not septated. And so mucormycosis it can cause. The disease is mostly in DKA people and leukemia patients, and it causes a purulent like disease. And this purulent disease is black pus exudating from the ears, eyes, and mouth. All right, that's pretty awesome, right? And so the fungi can proliferate in the blood vessel walls when excess ketones are present. And so let's see. I think that's about it on that one. Rhinocerebral or frontal lobe abscesses are present with this. You get a black necrotic SR. Where else did you get a black SR? Do y'all remember? Bacillus anthracis. Way long ago. This can also infect the cranial nerve of the face and give you headaches. Let's see. Do I have pneumo? Yeah, there it is. Pneumocystis jirovecii. All right, so this one right here is going to be a yeast that's inhaled. You get bilateral crackles or rails with it. Hepatosplenomegaly can occur. On plain film, you'll see the complete whiteout. That's the thing about this one, okay? Complete whiteout. As a matter of fact, let's just go whoosh, complete whiteout, all right? That's what happens with that one right there. Diffuse bilateral chest x-ray appearance of complete whiteout. You get a non-productive cough from that one as well. You get some constitutional symptoms, and you can treat that with like TMP SMX or dapsone. You get this one, the CD4 is below 200. All right, do y'all remember what else infects below 200? Go back and look that stuff up, okay? It's important. So now let's go. Don't forget I did a lecture on that. Just go back to those. So aspergillus fumigatus. All right, so this is going to have acute angles when it grows and it is septate. So let's spend a very quick moment on this, okay? So if you're going to differentiate between Aspergillus fumigatus right here and the mycoses, okay? The mucormycosis, you can think of it, all right, so here is an M, right? So on that M, we're making right angles. You see those right angles right there? And what if we flip that M like upside down? What would it become then? It would become a W with right angles to it, right? And the reason I'm doing all this flipping and stuff with it is because mucormycosis or mucor and rhizopus are going to grow in wide angles, okay? Wide angles, 90 degrees or more, okay? And so now when we get over here to aspergillus, right? Okay, it is an A for acute, right? It has acute angles. And see that little acute thing right there? See, this will be 90 degrees, but it ain't growing 90 degrees. It's growing that little acute angle right there, okay? It is not doing the full 90, okay? And so that's going to grow in 45 degrees angles or less, all right? So also, the aspergillus versus the mucorrhizopus. Remember saying mucorrhizopus is non-septate? Well, the aspergillus is septate. Okay, so aspergillus is transmitted via inhalation of airborne conidia, which are like cone-shaped stuff from rotting vegetation like asparagus. You can remember that for aspergillus. Okay, it's septate, has acutely branching angles, and may look like broccoli on microscopy. Look it up, seriously. And so you diagnose it with galactomannan antigen, galactomannan. And I will go ahead and tell y'all that it could be galactomannan. I don't know. I should have probably looked up some of this stuff before I go teaching it sometimes. I apologize, though. But that's okay. I've heard plenty of teachers mispronounce stuff way worse and continue on. So it makes me feel a little bit better. Anyhow, so that's how you're going to diagnose it. I think of him as being Broccoli Man, just to kind of remind me of, the asparagus and aspergillus, the broccoli appearance, and, and don't forget aspergillus, the A for acute angles, okay? And so you can get allergic aspergillosis, and if you get that, then you'll get like a fungus ball sometimes. And so it loves to inhabit past TB infected cavities, all right? If you see a cavity up inside someone's lung, it's not always TB. Remember that, okay? Could be aspergillosis, could be Klebsiella. There's a couple other things that I like to get up there and inhabit that kind of little cavitated area, so just keep that in mind, okay? You're going to look for other things like caseation and such to really get down to diagnosing on tuberculosis. So this sucker can get systemic. The fungus, if it invades the blood vessels, then it becomes rapidly fatal without some kind of a very aggressive treatment, okay? And then there's this thing, too, and first aid talks about it, ABPA, okay? And so if you have ABPA, that's allergic bronchopulmonary aspergillosis, all right? And so you can get those people, or get this disease. People that have cystic fibrosis or asthma are especially high risk for getting this. Immunocompromised people or people like chronic granulomatous disease are at high risk for this kind of stuff. And that will be a type 3 hypersensitivity reaction if you do get that. One final word is you can get hemoptysis with aspergillosis, and also you can get, or excuse me, not you can get, but malt grain workers might be at risk for this as well. And now, knowing the pathogenesis of it, you can kind of see why. Okay, guys, that brings us to the end. So my final question for you is, have you donated your $3? JoeyJohnsonDO.com. Go there, click on the donate tab. I would much appreciate it. Hey guys, I'd love to hear from you. If you remember the way to get in touch with me, go on my website, leave a comment. It's very secure. You have to enter an email address when you leave a comment. That's how, just kind of filter out all the creepies, and I'd absolutely love to hear from you guys. I hope everything's going well, or feel free to comment on the YouTube page as well. I wish you guys the best of luck, whatever test you're taking. And I've tried to keep these videos to a limit, under 15 minutes each. Some of them are less than 15 minutes, as you can tell. I try not to ramble too much. I know I talked fast at times. I apologize. But like I said, pause them, go back to them. I really think that if you've gone through the whole lecture by now, I don't think you will be disappointed on any test you take for micro. Unless you're taking an undergrad micro or graduate master's doctoral micro where it's not medical micro, then you might be, a little up the creek, but because we only focused on the medical micro. But I do not think anyone will be disappointed if you went through all of the lecture series. I wish you guys the best of luck, okay? Honestly. Take care.